31st is the deadline to sign up for Obamacare or face a fine that could be up to 1% of your income. And right now, there is no alternative. But the Republicans now say they have another plan. It's called CARE, the Choice, Affordability, Responsibility, and Empowerment Act. The GOP plan, instead of forcing you to buy insurance, offers tax credits to help lower-income people afford private insurance. It would also allow insurers to charge older people more, so more younger people could be covered. We're talking about doctors cut from Medicare Advantage networks facing a tough decision. What to tell their patients? Will they accept Covered California or not? Joining us this morning to talk about this subject is Craig Gussin. Good morning to you.
Good morning, Wendy.
It all sounds very confusing, rightfully so. A lot of people are up in arms. And I hear a lot of people are saying, I don't understand why I would get fined. If I don't want to have insurance, it should be my choice.
It's the law that they passed. If you don't want to buy insurance, you don't have to, but you're going to pay either a $95 penalty for a single person or 1% of income, whichever is higher. And that's just the way the law is, effective January 1st.
Let's talk about Obamacare.
Okay.
A lot of confusion out there. A lot of people still don't even understand how it works or what the benefits are. Let's talk about those benefits. Who does it actually work in favor of? It
works in favor of people who don't make a lot of money. So if you're making $20,000, $25,000 a year, you're going to get subsidies to help pay for or offset the cost of the health insurance. The cost can be anywhere from $2 a month and above. So if you're older or if you have major health issues, let's say you haven't been able to buy health insurance for the last 3 to 5 years because of a health condition and nobody would take you, now you can buy it. It's guaranteed. They have to take you. And if at the same time you're on a fixed income, now you can get it at a price you can afford. However, the plan that you can get at the price you can afford may have a $5,000 deductible. That is, out of reach for someone like yourself.
And it may not be accepted by doctors, right? Because there are a lot of doctors out there that are saying, hey, I'd rather quit than work with Obamacare.
That's exactly it. I had a client of mine come to me a couple weeks ago, and she's going to have a baby in about a month, and she said her OBGYN says we don't take Covered California. Well, I explained to her that she doesn't have a Covered California plan because we went directly to the insurance company because she wasn't going to get a subsidy. So doctors don't even know which plan is a Covered California plan, which plan is not, because everything's different. If you have group insurance, you have one network. If you have individual insurance, you have a network depending if you're in Covered California or if you're outside of Covered California. It's really confusing to everybody, even to us.
Simplify it for us and break it down. Why don't doctors want to work with it?
With Covered California, 4% of the premium goes to Covered California to help pay their bills. So one of the ways they're trying to keep costs down in Covered California is with what we call a limited network. So there's less and less doctors. Now, the other problem you run into is prior to January 1st, if you had a Blue Cross plan or a Blue Shield plan, you could see any doctor out there. Well, Blue Cross right now only takes Sharp and UCSD doctors. Blue Shield only takes Scripps, Palomar, Pomerado, and Tri-City doctors. So you really have to make sure that you know what network your doctor's in if you're going to have a plan in 2014. Again, this is for individual insurance, not group insurance.
And limiting those doctors makes it very difficult to get an appointment.
It does.
You can wait 2-3 months to see a doctor.
You're going to be seeing that. Because the people who haven't had insurance the last 2, 3, 4, 5 years, they're going to be the first ones lining up this year to go see doctors. And who knows what they find. And all of a sudden, this 10-minute visit could end up being a 2-hour visit.
And what happens if it's an emergency? You just go to the emergency room.
You're going to go to the emergency room, or you're going to go to one of the minute clinics or something. But it's a major issue. We've been saying this for years. The concept is a good idea. We want to get everybody health insurance. But they could have designed it better, which is why you saw the Republicans come out with a new approach.
And what do you think of that? Real quick, we're running out of time.
I love that approach. I've been saying that for years. Give people the option. If you're healthy and you want to go through the underwriting process and get a great rate, do it.
But take away from the seniors and give to the young folks?
Never take away from the seniors. There's a way to do it right. It was never done correctly. The White House and the Congress never sat down with the insurance industry and said, okay, tell me what's working, tell me what's not working, how can we design it together? They just put together something that sounded good on paper, but at the end of the day, it didn't work anywhere close to it. And we're seeing now what every agent and most insurance companies have been saying for the last 3 to 5 years.
Craig Gussin, thank you so much for being
My pleasure.
here.
Good to see you.
Appreciate your time.